Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And you know, we've had a number of inquiries about end of life, bereavement, things of that nature, the difficulties of incurable disease, painful episodes, things of that nature. And I know it's a difficult subject, and it's difficult to perhaps listen to some of it, but you're going to be, in quotes, alleviated by the comments that are going to come from our guests. So let me introduce our guests. In front of me is Tom Dalton, who is a director of music therapy program for Vitas Hospice. Welcome, Tom.
Pleasure to be here.
Good to have you, sir. Well, you're the third Vitas representative that we've interviewed over the last 4 years. We're very thankful for the service that you provide for the community and for really, you know, the citizenry. Thank you very much.
Our pleasure.
And to my left, Peter Willig. He's a clinical director of the Children's Bereavement Center. And you'll have to tell me both, what is LMFT?
I'm a licensed marriage and family therapist, and I have a fellowship in thanatology, which is the study and practice of death, dying, and bereavement.
Okay, so certainly you absolutely have all the credentials to be a clinical director, but usually, as I always say, you have to have the heart and soul in order to be able to take care of individuals. We talk to all kinds of healthcare professionals and people that are dealing with people with crises, pain, and I guess you could say their disassociation with what they want to have out of life, and then all of a sudden we have wonderful people like you gentlemen that are here. And so let's talk about the Children's Bereavement Center. Tell me what it does and tell me where it is.
I'd be happy to, and thanks for having us, and also for bringing up this topic. You know, you did say it's kind of difficult for some people to discuss, but we've been really one of the better kept secrets in Miami-Dade and Broward County for about 18 years. We started out and continue to be a nonprofit, providing free support groups to children, teens, young adults, and adults after a death. We were founded in 1999 by two psychologists, Mindy Cassell and Carol Burns, really on the premise that we shouldn't have to grieve alone and that grief is a normal and natural process, part of the life cycle, really. Over the years, we've developed our programs, started out really with one group, 8 kids from 5 different families in our first year, and have grown throughout Miami-Dade, Broward, and now going into Palm Beach County as well, to run about 80 or 90 groups a month, offering free support for children and families after a death. Interestingly, we've had a program here at Nova Southeastern University, with great thanks to Dr. Ronnie Lederman over at the Melman Siegel Center, and Jamie Mayerson there as well. That program's been running here at Nova for about 6 years, also providing free support groups to children, families, and young adults, including the Nova students. After a loss, they can come to our program for free. And about that time, we partnered with Vitas Healthcare really to replicate our model and spread just from Miami-Dade into Broward County and hopefully beyond, by taking on some of their clinical staff, training them in our model, helping us deliver groups, subsidizing some of the costs of materials and the pizza dinner and things that we give to the families that come to see us. Vitas has really gotten very involved in our programming, really to bridge the treatment and the comfort that they provide to families at end of life. Vitas Healthcare does an amazing job for patients and for families, helping comfort them when they're terminal or they're facing a life-threatening illness. And the Children's Bereavement Center, in partnership with them, really has over the years developed a great resource for the families that survive the death. Vitas helps us deliver that up here in Broward County, as well as in the Miami Shores, the Doral Fontainebleau area, and hopefully in the near future in Palm Beach as well. And I was speaking with Tom earlier and just saying that one of the special features of our program here at Nova Southeastern University is the music therapy component that he and his interns have been able to bring to the programming. It really opens up both the kids and the adults. It's become such a strong component of our programming, really, that we've incorporated into the groups at the other locations that we serve families through down in Dade County as well.
Okay, Tom Dalton, that's a good segue right into what you do. And one of the reasons why I really wanted to see you here is because of the music therapy program. But let's talk in general about the services that are provided through Vitas, and obviously I want to focus in on the music therapy program. So it's all yours.
Pleasure to be here again. And Vitas provides a full team of professionals that serve our patients, and music therapy is part of that team. We have physicians, nurses, social workers, and chaplains, music therapy, massage, and even pet therapy. But music therapy is such a powerful intervention that I find in working with hospice patients. It helps bring a sense of comfort and joy to our patients that are dealing with a life-limiting illness. It also, we can address relieving pain, anxiety, and stress, and it offers opportunities for communication with our patients on how they're coping with their illness through the music therapy process. Some of our interventions are therapeutic songwriting, where we'll write a song with our patients to tell their life story and record it and give that as a gift to the family, which is like an audio legacy. We'll use guided imagery and music to induce deep relaxation with our patients, which also helps with pain. And I think the great thing about music therapy is that it works on many different levels, on the physical, the emotional, psychosocial, and spiritual. And we see this especially with music therapy for our patients with dementia and Alzheimer's disease, where they're no longer able to verbalize or communicate. And suddenly, when you offer some of the songs from their childhood, they're singing, every word to the song and having this successful communication. And part of that is the way that music is processed by the brain, opening up pathways to memory, thoughts, and feelings, and getting them in touch with what they're feeling. So it's a great intervention. And so we're so excited to partner with the CBC, Children's Bereavement Center, and continue music therapy with our bereaved families. It's just a extremely flexible modality, and it can work with a variety of different people. But I have seen such tremendous benefit with those that have been attending the CBC, especially the children. I was a facilitator with the middle school group for many years, and music and art, the expressive arts, is a way for children especially to communicate through sort of non-verbally, because a lot of children aren't able to find the words to express how they're dealing with a loved one's death. So music and art, we do drama, we do storytelling, all of these different procedures and modalities really help the children express what they're going through.
What they're looking for is they're looking for quality of life. Well, quality of life is not only measured by after a death and presenting to, as you gentlemen both present to the surviving families and otherwise, but it's the ability that is intended through hospice care to bring a quality of life element to the end of life feature. So you want to talk a bit about that?
Absolutely, and that is really what we're about, and that's why we're so excited that people are coming into hospice care, into Vitas earlier and earlier, because it's not about coming in, when you're approaching death. It's about that quality of life that you're speaking about, and we have so many programs that add to the quality of life of our patients. I'm thinking of our special music therapy program with our patients with COPD, and this was a pilot program involving singing involving songwriting and having them play a special instrument that is connected to an iPad and a computer, and they blow into the mouthpiece and are able to make incredible music, playing flute, saxophone sounds, keyboard, drums even, and have this wonderful, enjoyable experience with the music therapist making music, their favorite music. This study showed that this process that we went through with these patients, it really improved quality of life in various indicators of quality of life, reducing depression, increasing positive mood, increasing communication, and also having a benefit to the respiratory function. And so this is a very exciting program that we're doing with those patients.
We're going to put on a little video that Tom Dalton does relative to the care and the understanding of COPD and what goes on with the therapy entity and using music. I want you to take a look at it. So take a look.
Sounding good. All of me. Woo, that was a good one. See how fast you're getting, like, really great at it.
Really?
Yeah.
Good.
All of our programs are designed to improve quality of life. With music therapy, we are, of course, playing the favorite songs of the patients and actively engaging them in music making. And because of the process, it's very non-threatening, so patients will oftentimes share their feelings, what they're going through, and that happens more with music therapists than perhaps those that do talk therapies and counseling, just simply because music is a non-threatening medium. So quality of life is what we're all about in hospice.
Well, I'm glad that we got to that. Peter Willig, with the Children's Bereavement Center, it's really, when you think of it, it's, I don't know what word, the word comes to my mind, the tragedy of losing a loved one, a mom, a dad, a brother, a sister, as a child, is daunting. So your work, which I see as a blessed venture, is something which is really something which I think a lot of viewers have not been aware of and still are not aware of it until they unfortunately come across a situation where they need that help.
And I think that's a great point, and I really appreciate what you and Tom are discussing in terms of the quality of life, because it's hard for me to communicate how happy and uplifting the programs that we offer are. The circumstances of these families' deaths are certainly daunting, and the circumstances are certainly traumatic in many cases, but the model of the Bereavement Center really is to normalize that experience and to focus more on the adjustment, the recovery, the transformations, and even the hope that comes afterwards. Where Vitas offers their best support is not just in the patient care that they provide, but the extended support that they give to those patient families. And the Children's Bereavement Center does the same. That's where I think we make a great partnership. We have children of all ages, as well as adults and elders coming to our programming, and what they're talking about really is grief is an ongoing and developmental experience. It's not a 6 weeks and then you're fixed, or 6 months and you've gone through the stages and you're done experience, especially for children. They'll grieve throughout their lifetime. So the fact that our groups are open-ended, families can participate for as long as they'd like, as often as they'd like. They can start at any point during the year if they like. It allows for the normalization of the grief experience. And they also come into group and they see on the first night that they're not the only ones experiencing grief and loss. We don't differentiate the nature of loss. So where you were discussing suicide as a specific experience, and we have multiple families that come to us after homicide and accidents and illnesses, we bring people together with the feelings that they experience and the transitions that they experience related to the death. The whole family, by the way, not just the children, but parents and elders and support systems are welcome to participate in our groups as well. So they can continue the conversation from week to week back at home where they function.
You know, it's an interesting thing. I think we think of the word bereavement, just like, you know, in each religious grouping, they have a period of time of mourning, you know, or a period of time where there's certain remembrances relative to prayer and things of that nature. But, you know, bereavement really is something which stays with individuals forever. I mean, I was just, Father's Day, we were talking, my children and my grandchildren, primarily my children, were talking about my mother and father. Now, they were little children, you know, pre-teens, when my father died, and my mother died when they were early teenagers. But yet they were talking about events with happiness, and tell me if I'm wrong, because you guys are the experts, but bereavement has a happy moment. It's because it's a memory. Am I correct?
I think that's the goal of the services that we try to provide. You're right to assume that grief is an individual experience. What I feel about the loved ones that have died in my life is very personal. Sharing that, though, and not feeling that there's a pathology or that there's something that needs to be fixed is a really important concept, I think. We don't provide clinical therapies. We provide peer support groups where people are coming together with others to support each other and to learn from each other at different stages or different experiences in their grief. The most amazing thing for me, though, is that when you bring children together with other children and you add modalities like music especially, we really are very play-based. We really are very expressive. There's a lot of arts, and Tom's modalities and the use of his internship program and the camp that Vitas runs in partnership with many of our families is really some of the brighter work that you can be involved in. We take on volunteers, and they regularly say that at the end of a long day, even though we're talking about death often, they walk out feeling uplifted and they walk out feeling relieved to see these families healing and adjusting. And I think Tom can speak just to the impact of how playful and energetic and expressive the groups are with his interns.
You know, it's interesting, Tom, if I may call you Tom.
Sure.
That in listening to what Peter has just said, I remember listening to the founder of the Mailman Siegel Center, Mickey Siegel, Dr. Mickey Siegel, and she wrote many, many books and was really nationally and world-renowned because of the idea of the importance of play. I learn a lot from listening to my guests, and I hope the folks out there are learning also. But the whole issue of especially today, with the ability that we have through advanced new medical techniques and the ability to modify the inherent cleared situation where someone is going to pass on. But the elongation of that period of time may cause, during that period of time, some elements of, I guess, psychological depression and otherwise, which enables you to use your techniques. Am I correct?
Absolutely, and they're living for much longer. Many of our patients will live much longer, and so it becomes important to offer services like music therapy to engage them in just enjoying life and being able to communicate what they're going through. And oftentimes we bring the family into these sessions, and we'll bring instruments and do musical improvisation with our families, as well as at the Children's Bereavement Center. You were talking about the importance of play. That is so important in terms of healing from grief. We don't, as Peter mentioned, we don't do clinical therapy as part of this program. It's a peer support. That doesn't mean that what we do is not therapeutic. And so what happens in these children's groups is based on play and improvisation. We follow the lead of our children, and sometimes they may not feel like talking about their loved one that has died. They may just want to play four corners or do different music activities that aren't centered on grief. But what happens if you create this safe environment is that the grief will come out. Over time, people will express, and it becomes a very powerful process following their lead. Now, Peter mentioned we have a camp, Camp Vitas, that we offer to the community, and this is a great opportunity for families in the Broward, Dade, and Palm Beach area to join with us for this 2-day overnight camping experience. And this is for children and teens that have lost a loved one, ages 7 through 17. And the camp combines traditional camping activities such as swimming, hiking, canoeing with expressive arts, grief processing activities so that they can work on things that are troubling them in terms of how they're coping with their loss. But the greatest thing about the camp is just being with others that have gone through this, their own age, because like you mentioned, children think they're the only ones that are going through the loss of a loved one. They feel isolated, and suddenly when they come into a community of other children that are going through the same thing, it's extremely healing and powerful for them.
Now, how does one find that? Do we have an address or
Well, it's sponsored by Vitas Healthcare of Broward, and Camp Vitas. What I usually do is I send it out to the media,
right.
But our next camp is in March. We use various campgrounds in the area: the Hugh Taylor Birch Campground, the Owasso Bower Campground in Dade, and last year we did something very exciting. We went to Fort Wilderness in Disney World. But again, anyone can join this camp. We are going to do a lot of media exposure to get the word out about it. They can call me directly. I'm the camp director, and I can send the application.
You'll give us the number. We'll put it
I
on.
will.
We'll put
Yes,
it up.
absolutely.
Thank you very much.
You're welcome.
And Peter, how does one reach the Children's Bereavement Center? Where are you located? And
We have, as I said, we started out with one group 18 years ago. We now have about 80 or 90 groups running a month, and we last year served about 1,300 individual participants, so we've grown quite a bit in partnership with Vitas as well. It's one central number. They would call the number, we'll put it on the screen. They would get our central office, and then what we would do is we would connect that family directly with a site coordinator like Tom at the Broward program here at Nova. We have other site coordinators from Vitas and from our staff that run the program we have in Coconut Grove, in the Doral Fontainebleau area, and in the Miami Shores area, and we're starting up in Palm Beach as well. So if they just call the central number on the screen, we'll be able to connect them with the person coordinating the program closest to them. And again, it's free. There's no cost. We don't bill insurance. It's not billed as a therapy or anything like that. So children of all ages as well as adults can come, even where adults don't have kids participating in the program. We are called the Children's Bereavement Center, but I think primarily because of our relationship with Vitas, we do have a lot of adults and even elders that are coming to our support groups.
Well, I just want to let you know that, first of all, I think there's a great opportunity. There's a lot of our undergraduate students that would like to serve in fellowships that would be available to you, and we are known for our community service, so that's certainly part of it. But I will tell you, as someone who's very familiar with the Health Professions Division here, with our 8 colleges and nearly 35 programs, there is an element being used in all of the teachings that there must be empathy, there must be reality to the fact that there is something beyond just health care. There has to be the human factor involved, and a lot of it relates to exactly what you were talking about. So I just want to let you know that we're very pleased to have both of you here for the purposes of telling us about something which is, you know, to some people it's difficult. But the reason why you're both doing what you're doing is to make it not difficult, but to make it a lot easier for the victims as well as the associated relatives, neighbors, and otherwise to be able to not necessarily cope with, I don't know whether coping is the right word, but really work with you and your knowledge and your techniques to enable people to understand that there is another part of life that can be carried with beauty and victory and happiness from those who have passed. Is that about it?
Well said.
Yeah, I think that was
beautiful,
very well
yeah.
said. It is about the adjustment and the quality of life, even that takes place after the death, I think.
Okay, well, we're down to the last minute of this show, so I want to thank you both. Tom Dalton, you're a director of music therapy for Vitas Hospice, and you work with other people like Peter Willig, who is the clinical director of the Children's Bereavement Center. I want to thank you both for the viewers and for the community at large, because it is not an easy task to do what you both do. Remember, this program is called Dateline Health. If you have any questions and you want some answers, there's an email address right here. And we come to you from Nova Southeastern University. Remember, this is your show. I always end it by saying take good care of yourself, and certainly you want to take good care of yourself, because in spite of the fact that these two gentlemen are telling you about end-of-life issues and bereavement, I want you to be able to be there to be able to help not only others but yourself. So take good care of yourself. My name is Fred Lippman. This show is called Dateline Health. Until next time, see you.